Hello, and thank you for joining today's webinar. We will be getting started in 1 minute. Hello, and thank you for joining today's webinar. We are ready to begin. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentation, we will have time for a question and answer session. You'll see on your GoToWebinar control panel that you can send a message through the questions feature. This is where you can type in any question you'd like to pose to the presenter. Be sure to hit send so the message makes it to us. On behalf of Sigma, we would like to thank our speaker for sharing her expertise with us today. Our speaker is Dr. Lois Marshall. Dr. Marshall, a nurse educator for 40 years, has held a variety of faculty administration positions at the University of Miami School of Nursing, where she taught for 26 years, before leaving to pursue a consultative career in nursing education, evidence-based practice, research grants, and career development and management. She has received numerous awards for her teaching throughout her career. Dr. Marshall holds a BSN from the University of Miami, an MN from Emory University, and a PhD in higher education from the University of Miami. Her doctoral dissertation focuses on variables that predict success on the licensure examination for registered nurses. Dr. Marshall developed her own NCLEX review program focusing on unique testing strategies, linking and conceptualization to assist in meeting the studying and testing needs of all new nursing graduates to be successful. She has traveled across the country as well as working online to provide assistance and intensive mentoring to students in the areas of test taking and licensure preparation for the entirety of her career. She has worked with students internationally in the preparation for their NCLEX RN as they plan moves to the United States, as well as nurses from other countries that are currently living in the United States. She has worked with new graduates and nurses from Cuba, the Philippines, Australia, and South Africa. Now let's go ahead and get started with today's presentation.
Thank you, Erica. I appreciate it. Welcome to all of you. First, let me apologize for not being on camera. It's a little stormy where I am, and I don't want to lose the connection. So the staff, Erica and Megan, are being very nice to sort of help me get through all of this. So I appreciate that. If you have not been on one of my webinars before, we're going to talk a little bit about some just general information, and then we're going to do a lot of practice questions today where you'll have the opportunity to get your answers recorded, and then I'll go through all of them with you so that you can see what's right, what's wrong, and then how you could answer it. Also, if you were on the webinar in July and you asked me to send you answers to some of the questions that we didn't go over, and I haven't gotten them to you yet, my computer has crashed and I just put it back together. So I'll be sending those out after the webinar today. My contact information will be on at the end, and anybody that wants to contact me about anything in this webinar, previous webinars, or just in general about getting ready for the boards, feel free to do that. Okay, so I thought I'd start with myths about the exam, because lots of people post questions to me on particularly my Facebook page about the test. And so just to remind everybody that the number of questions that you take on the boards is not linked or relative to your success or failure. People, even with a shortened test, so now you take a test that's between 60 questions and 130 questions, and you have 4 hours, people associate, well, if I take 60, I passed, and if I take 130, I must have failed. And that's a myth, okay? If you take 60 or 130, you have an equal chance of passing. So you have a 95% chance of passing if you take the smallest amount of questions or you take the largest amount of questions. The most important thing for you is not to worry what number you're on, because 50% of being successful on the boards is your psychological preparation. It's how you feel. It's how you respond to being there and taking the test. And if you are focused on all of your friends and everybody telling you, well, I took 60 and I passed, and you get to question 61 or 62, you set yourself up to think that you failed. And then for some of you, you will fail because you've sort of damaged your confidence in your ability to be successful. So don't worry about the number of questions you're taking. The important thing to remember is as long as the computer is giving you a question, you have a statistical chance of passing. So as long as the computer is giving you questions, just think of it as question number one and just keep answering them until the computer stops. And don't worry about what question number you are on. Okay? The length of time is also not linked to your success or your failure. It doesn't matter if you take your test over an hour and a half or if you take the whole 4 hours. The length of the time is just based on how fast you're reading the questions. For most of you, you should not spend more than a minute and a half to 2 minutes on any question. And so I generally tell people, if you sense that you've been on a question for longer than 2 minutes, just guess and go. Because educationally, if you lament and you try to rewrite and you try to convince yourself of a question for longer than 2 minutes, you're going to miss that one probably, and you're going to miss the next up to 5 of them, just because you're still thinking about the one that you were sitting there trying to figure out. So don't worry about how long it's taking you. Just remember that no question should take you longer than 2 minutes. If you're a slow test taker in general, then make sure that you practice time tests as you get closer to taking your boards. And if you're a fast test taker, you need to do the same thing. Fast test takers in general miss keywords, which makes you miss the questions, and slow test takers tend to rewrite the question in the way that you want to have it rather than the way it's actually written. And then you also tend to miss them. So you need to look at that in yourself. The type of question has nothing to do with your success or failure. People ask me all the time, well, my friend said I got a lot of select all that apply. So if I got a lot of select all that apply, does that mean that I'm going to have a shorter test and I'm going to have passed? No. The computer is going to adapt or pick your next question based on how you answered the previous one. And in the pool of questions, there are all types of questions. There's regular multiple choice, there's select all that apply, there's auditory questions, there's ordering questions, there can be med-calc questions, whatever it happens to be. There can be drop and drag questions, there can be pictures where you have to identify something. So you don't want to worry about the type of question and then get yourself all hyped up. Oh my God, I'm not getting a lot of select all that apply, so I must be failing. Because again, it's a self-fulfilling prophecy and then you will fail. So don't worry about this. Forget all of that stuff, that noise that's out there around you. Okay. The state that you take the exam in is related to success or failure. That's also a myth. I have lots of students contact me and say, I heard that the test that's given in Alabama is easier than the test that's given in New York. No, it's the same pool of questions for all 50 states and territories where the NCLEX is given. So it doesn't matter where you're taking it. It doesn't matter where you're getting licensed. It's the same pool of questions. Makes no difference. Okay. Another thing I get asked a lot is the NCLEX easier now because of the changes due to the pandemic. That's false. The NCLEX has the same standard. It has the same pass score that the computer will determine for minimal competency. So it's not any different than if you were taking it before, except for the number of questions. So instead of 75 to 265, now you're taking 60 to 130. And instead of 6 hours, you now have 4. That's the only difference. Nothing else has changed in the NCLEX. So don't worry about that. It's not harder and it's not easier. Okay. The best studying is done by reading a review book. That's false. So for those of you who are sitting and reading through review books, That's not the way to get ready for this test. That's a good way to get ready for school, but that's not a good way to get ready for the licensure exam. The licensure exam is an exam. And the best way to study for that is by taking practice questions or practice tests, because you have to become test savvy, which is what I teach, which is what I am so passionate about. The more savvy you are, or the better test taker you are, the better you're going to be at becoming successful on the licensure exam. So review books are good to go back and look at when you don't know the rationale for something. It doesn't make sense. You've taken a test, you've sort of graded it, you missed a bunch of questions, the rationales don't make sense to you, and then you go back and you can review it in the book. But other than that, you really should not be using a review book for just simply reading, because all you're going to do is read the same thing over and over and over again, because a lot of the things that we do from a nursing intervention perspective are the same things. The thing that changes is the health alteration, or whether we're doing it as a first or a last, or whether we're doing it as we need to educate or we don't want to educate. So as examples are great, but just reading over and over and over again isn't going to be helpful to you. So I recommend that everybody just practice with test questions. And if you want to know the kinds of things I recommend, I can talk about that at the end. And then focusing on what your friends or your faculty tell you about the exam, it helps you be successful. That's also false. Just disregard what your friends are telling you, and disregard what faculty tell you, because nobody knows what's going to be on your test, other than there is a chance for everything that's in the test plan to be on your test. But beyond that, it's not about what other people have had. I have students all the time say, my friend got a lot of questions about isolation techniques, so now I need to go back and review that. No, just because they did doesn't mean you did. Remember that the questions are adaptive to how you answered the previous one. So I know it's hard to get rid of all of that stuff, but again, you just have to ignore it as much as you can. Next slide. Okay, so when you're preparing, the most important thing is to know yourself as a test taker or studier. So what worked while you were in school? Were you a slow test taker? Were you a fast test taker? Did you have difficulty reading? Did you have a harder time with certain types of questions? Are you better at studying, in long periods of time or shorter periods of time? Are you better studying by yourself or with somebody else? So what do you know about yourself as a test taker or studier that you can then use as you're studying for the boards? And then what are those things that didn't work for you or you weren't really successful at, that you need to change as you prepare for the boards? And because you've all been studying, you should know this already. As you prepare for success, then you want to look at, again, what to use for study preparation. So I sort of talked about that already, using practice tests. I'm a real advocate of just taking a test, whether it's 60 questions, 100 questions, 130 questions, take the whole thing. If you're doing them online, take them as a test, not as a tutorial, because you don't want to look at the answers after every one. You want to actually mimic what it's going to be like to take the board. So take the whole test, then grade the whole test, read every question that you missed, particularly what was the rationale for the right answer and what was the rationale for all the wrong answers. And then again, go back and review what you don't know. Or if you're on this webinar, you can just send me an email, or you can post something online or message me and say, I don't understand this. Can you explain it to me? So that's the advantage of being on this webinar, is that you now have a connection to somebody who can answer the questions for you if you really don't understand it and it doesn't make sense. And I don't mind that. So what do you use for study prep? Okay, I recommend that you just go buy like a question and answer book. If you want to do that, you can use things online, but be really careful with what you're using. For those of you that are in schools that have NCLEX review as part of the program, you paid for something or they paid for it, you have ATI, you have HESI, you have Kaplan, then you can use those. I don't love them, but you can use them because anything is better than nothing. And so just use what you're comfortable with because you've been using it all the way through school. If you want to go out and buy something, either again, online or a physical book, anything by Saunders, um, anything by anything by Saunders, anything by Mosby, or anything by Lippincott. Those are good publishing companies that put out good books. So Saunders is Silvestri. That's the one that I recommend the most if you're going to go buy a book. Mosby is Saxton, is the editor. Lippincott is Billings, and I recommend those. If you want to do something online, the only two things that I recommend online that are irrespective of book publishing companies are any of the materials that come from the National Council of State Boards of Nursing. So you just go on www.ncsbn.org and you can find their materials. Those are materials that are prepared not by the National Council that writes your exams, but by a company they contract with. And you can use that. And then lots of people have used UWorld. I think UWorld is fine if you like that and you want to use it, it's perfectly fine. I do not recommend anything else because I don't have the ability to say that it is truly NCLEX preparatory. So don't waste your money on other kinds of things. How much should you study? So this is a question also that I get all the time. Don't study nonstop 24 hours a day. Okay, I have lots and lots of students that I tutor, lots of students that contact me and tell me they're studying 8 hours a day. That's too much. You can't focus when you're studying that long. And you remember this from school. You should not need to study more than 2 to 3 hours a day if you do it effectively. So if you take a test and you grade it and you review it, that should basically take you somewhere around 2 hours, or for some of you, it may be 3 if you're taking a longer test. But other than that, that's what you should be doing because that's going to make you better prepared for a test. Okay, remember, you're not trying to learn nursing school all over again. You've already done that and you've done it successfully because you graduated. So now you're just trying to learn how to take a test. And so that's the best way to do it. So if you want to study, if you're completely just obsessed with the fact that you have to study more, then study 2 hours in the morning and 2 hours in the afternoon or 2 hours in the evening. But I don't really recommend studying any more than that. And I only recommend that you do that 6 days a week. I always recommend that everybody take a day off just to refresh their mind, refresh their brain, do something fun, and just get out of your own way. Okay, you're your own worst enemy when you're studying for the board. So you need to get away from out of your head and out of your out of your way. So I recommend 2 to 3 hours a day, 6 days a week, and you should be ready. Okay. How long you should do that is going to be relative to how long or how close you are to taking your boards. I like people to study for 4 weeks at least, but some of you may have test dates that are coming up, but you've been studying, so that's fine. Make sure that you at least know what's on the test plan. So again, you can go on the National Council of State Boards of Nursing website, or you can look in any review book and the test plan will be in there. Just make sure that you know what's on there and what you should have a general idea of what kinds of questions are going to be there. I generally remind students that number one, memorization is the worst thing for you, with some exceptions that I'll go over on the next slide. But you do remember that it's an RN exam. So the majority of the test is related to what registered nurses do, not what doctors do, not what nurse practitioners do, not what LPNs do, not what nursing assistants do. This test is based on us and what we do. Okay. It's also primarily based on application questions, those kinds of things where we're doing something. Okay. They also, there's a lot of questions on evaluation. Like, how do we evaluate if something is good? How do we evaluate if someone has a risk? How do we combat that risk? Those kinds of questions. And then from a clinical standpoint, about 78 to 80% of the boards is med surg across the lifespan. So that's the majority of the test. there's about 9% of the pool of questions is psych mental health, and 9% of the pool of questions is maternity. So if those were not your strengths in school, again, I don't think that you should go and just study those things. The more comprehensive the tests you take, the better it is, because that's the way the boards is. So mix the questions up, make up your own tests from quizzes that are in books and mix them up that way. But the majority of the test is going to be a med surg across the lifespan. So that includes adult and kids from a health alteration standpoint. It's also important to remember that the boards, and you should know this already, but just to reiterate it, the boards is written or redone every 3 years. So what may be on your boards may not be the latest and greatest thing that you saw in clinical practice. So it's important to remember that this is a book test. It's not a clinical test. So if you saw something unbelievable because you were in a big Research One academic center when you went to school, that's all fine and good, but that may not be on the boards. So you don't want to then say, oh, well, I can't find an answer to something, because the test plan is based on how nurses practiced when they were first employed after they took their board. So for some of you, you'll get like an email after you successfully pass the boards, and it will say, in your first job, what kinds of patients are you taking care of and what kinds of things are you doing? And then that's sort of how they determine what the test plan changes should be. So if you see something in clinical, a health alteration specifically, that you see over and over and over again, then there's a good chance that that has the highest priority of showing up on the board. So things like, MIs, diabetes, hypertension, those kinds of things we see a lot of. But the most obscure thing that you may have seen one time is probably not going to be in the pool of questions. So you don't want to get yourself, again, worked up about that. Then you want to make sure that you can control the circumstances that you can control. So some of the things that I've mentioned already, making sure that you're studying consistently, making sure you're asking for help when you need it, and you're asking the right people for help when you need it. You're not asking your friends necessarily. Making sure that you are at your best when you go and take the boards, meaning if you're sick, if you've had, God forbid, a death in the family, if your kids are sick, whatever, try, if you know that 24 hours ahead of time, change your test date. Don't go and take your test when you are not psychologically and physically ready to do so. Those are all things that you can control. The environment that you are studying in, you can control those things. The uncontrollable things are those things that you can't. Traffic is really bad, so now you're getting anxious driving, or the fact that you can't get a test date for another 4 weeks because there's not as many spots because of the pandemic. Those are things that are out of your control. It doesn't matter. You can't fix it. So you have to take what's there. That doesn't mean that, say I'm ready to go take my boards and I go online, I get my authorization to test, I go on Pearson, I'm trying to find a test date. Okay. The next test date is like September 20th. And I say, oh my God, I don't want to wait till September 20th. That's like a long way away. But there's also a test date for tomorrow. Okay. If you do not have the psychological fortitude to say, okay, I can just go take it tomorrow. I've been studying, I'm ready. Don't just take the date because that's the date that's close. Because again, you're setting yourself up to maybe not be successful. So that goes back to knowing who you are and what kind of test taker you are. And do you have the ability to just go if there's a date available versus maybe having to wait an extra 2 or 3 weeks because that's just the next available date. And so just check every day. Dates get released all the time because people change their dates. So if you didn't get a date until September 20th, you could go back on Pearson tomorrow and there'll be a date for September 15th. Take that date and just until you find one that's in your comfort zone. So control what you can, and then those uncontrollable things, just sort of let them go by the wayside as much as you can. Next slide. Okay, so I'm all about linking to other material that you know, conceptualizing and using test taking strategies that are very unique, that are mine, for the NCLEX. And so if you were not on any of the webinars where I went over my test taking strategies that were very specific, they had numbers included in them, and they talked about how to pick up adverse effects for drugs and how to pick out other types of things, side effects and things like that, then you can go back in July's webinar, which is in the repository. So anybody can go into the repository. You don't have to be a Sigma member. And you can get the July webinar of mine. And I talked about that at the beginning. Okay. So there are some things that can help you with that. And then if you don't understand something, you can email me or you can message me. As far as linking and conceptualization, first of all, I'm not a big advocate of memorizing everything. If you try to memorize everything and you get to a question on the boards and it's not written in the exact way that you memorized it, you're going to miss the question because your brain is not going to be able to refocus so quickly if you've only learned things in a very anal retentive, OCD, I have to see it this way. So you want to make sure that you're trying to think broad and more globally, or again, conceptualize things rather than just memorizing. Now, that's not to say that if there are health alterations where there is something that is very defining about it, excuse me, where you have a defining assessment, for example, that it's the only thing that can possibly be. Some of those things, yes, if you memorize them, they're not going to hurt you. So for example, if you got a question on the boards and it said that your patient presented with current jelly stools, what do you anticipate the physician would work the patient up for? Okay, so current jelly stools goes with intussusception, okay, which is a pediatric disorder where the intestine is involuted into itself. So you get current jelly stools. You're not going to see that with anything else. So yes, if you memorize that, that's fine. Okay, that's a good thing. If you got a question about a adverse effect of aspirin, and they're asking you what that is, tinnitus is sort of an exception to the rule. Tinnitus or ringing in the ears is the adverse effect of aspirin. So yes, if you memorize that, it's going to help you. But if you memorize every single assessment for every single thing, and some of them are similar all the way through, for lots of health alterations, it's not going to help you. So you can memorize those things that are unique or really specific to something, but don't try to memorize to study for the boards or to practice for the boards. Just try to think broadly. You know, what do nurses do? What kinds of things can we do to protect the patient? What kinds of things can we do to prioritize? You know, go through that mantra in your head, ABC, other physiological, including pain, safety and security, love and belonging. Listen to yourself, say those things, and then do them when you see those questions. When I talk about linking, I'm talking about using something that you know to help you with something that you don't. So for example, on the very first slide, I said, you know, reading a review book is not really good. And that's because if you read a review book, you're going to find that for every health alteration where surgical intervention may be necessary, you're going to get the same pre-op and post-op information for all of them. So I guarantee you, if you went through a board review book that you might have, and you looked at how many times pre-op and post-op care was written about, you've read it like ad nauseum. So if you know it for one thing, you know it for all of them. You know pre-op care for this patient, you know it for every other patient, with the exception of where the surgical site might be. So that might be different. Or what's the age of the patient? Okay, so that might make it different. So those are sort of the exceptions, but the general broad overall care is the same. Okay. Another example that I use a lot, and you might have heard it if you've been on another webinar, is how many times you've learned about hypertensive crisis in school. So you learn about hypertension in your, you know, in one of your first classes, you learn about hypertensive crisis in maybe another course. And then I might say, you know, now we're in a critical care course or an advanced med surg course, and you learn about autonomic dysreflexia. Autonomic dysreflexia is a hypertensive crisis. So now you've learned it again. If you get to maternity and you learn about preeclampsia and eclampsia, or pregnancy-induced hypertension, that's a hypertensive crisis. So now you've learned it again. And then when you get to psych and you learn about MAO inhibitors, the toxic effect of an MAO inhibitor is a hypertensive crisis. So now you've learned it again. So instead of relearning it over and over and over again, if you know it for one thing, you know it for all of those things. The general nursing care for those patients is the same because they have a hypertensive crisis. So if you get a question on the boards about managing someone with autonomic dysreflexia, minus the fact that there is a specific thing that we do for them first, which is to check for bladder distension and check for bowel impaction, because that is generally the cause of the hypertensive crisis. And if you find that and you relieve that, then their blood pressure should come down. But minus that, we manage those patients in the same way. So if you can't remember that, but you remember about hypertensive crisis or pregnancy-induced hypertension, or what you would do for the patient with a toxic effect of an MAO inhibitor, then you can do those same things for this patient. And that's linking the information together. It's knowing it for one thing and then sort of saying, okay, I may not know everything about that, but I can link it to something that I do know. Okay, so it's important that you remember that. By that same token, the opposite of autonomic dysreflexia is spinal shock. So if you can't remember what autonomic dysreflexia is, but you know the opposite is spinal shock, well, in shock, their blood pressure is falling. So in autonomic dysreflexia, it's going up. So again, it's linking all of that information together that you have in your head that you've learned all the way through nursing school in a silo. You've learned it as individual things. And for the boards, the best way to be successful, the most effective way to be successful, is by putting all those things back together and linking them together and looking at them as pieces of a bigger puzzle rather than individual separate things. So another example relative to the hypertension that I would give you is in pregnancy-induced hypertension, the drug of choice is mag sulfate, right? We give patients mag sulfate in order to try to prevent them from going from preeclampsia to eclampsia. Okay, so mag sulfate does two things. It relaxes smooth muscle, which brings their blood pressure down, and it depresses the central nervous system, which prevents them from seizing, which is a risk factor in someone with hypertension or hypertensive crisis. So in the real world, okay, in clinical, you may only see mag sulfate used on a maternity floor. Okay, but in theory, mag sulfate can be used for any of those patients, because any of those patients, autonomic dysreflexia, pregnancy-induced hypertension, hypertensive crisis with unknown reasons, or the adverse effect of MAO inhibitors, all of those things, the risk is for seizures and for hypertensive crisis. So if you can give them mag sulfate, which depresses their central nervous system and relaxes smooth muscle, you're going to get the same effect. So mag sulfate's not a maternity drug. It's a drug used to treat or prevent someone from the complications of hypertensive crisis. So that sort of is a way that you can look at this to sort of help you with these things. Okay. Also, looking at health alterations in the opposite. So this works good with endocrine disorders, MI versus angina, hyperthyroidism versus hypothyroidism, syndrome of inappropriate ADH versus diabetes insipidus. So that, again, it's linking all that information together. If you know it for one, then what else can you use? Okay. The same process works with conceptualization. And I look at this more like individual things. Like if you're talking about oxygenation, and we are interested in looking at oxygenation because we have a patient that's bleeding or bleeding out. Bleeding is the same for everybody. We manage bleeding the same for everybody. We need to increase whatever it is we need to do to increase their cardiac output or stop the bleeding so that they get more oxygen, or the concept of oxygenation, out to the body tissues and back to the heart. So if you know how to assess someone for bleeding, you know how to assess it for every patient, unless, again, it's something very specific that's exactly related to one particular disorder or not. So someone who's bleeding from hemophilia, you have to worry about factor 8. But in general, we're still looking for all the same things. We know how to assess someone who's bleeding. Where are they bleeding? How much are they bleeding? What's the color of the blood? What's the consistency of the blood? Is it thick? Is it thin? Is it clotty? Okay, all those things are the same. Where you're actually looking. And then the primary nursing intervention, besides stopping the bleeding, is to protect the patient. Okay, we don't want them to bang into things or injure themselves because they're going to bleed out if they have that tendency. So that I just told you, we can now link to drainage in general. Drainage is the same as bleeding. It's something coming out of the body. What's the color? What's the consistency? What's the amount? And minus blood, a lot of drainage, we want to know the odor, because it can tell us a lot about what's going on with the patient, and maybe what kind of organism they have, because it smells a certain way. So those things, then you can link back to that. So again, in layman's terms, it's just taking what you know and using it for as many things as you can. And if you do that, then that's going to assist you on the boards. And the reason for that is, if you know the answer to the question, you know it, then just move on, just answer it and move on. But if you don't know the answer to the question, the strategy can help you then, the linking can help you then. But if you just do this when you go take your boards, you're going to get yourself all confused. So I try to recommend to people that start doing this now when you're studying. You know, when you get stuck on a question, what can you use? What do you know that will help you answer that question? What things do you know are wrong? Okay, if you're using process of elimination, what things do you know are wrong? And then whatever is left, if it's a multiple choice and 3 answers are wrong and you know they're wrong, then the 4th one has to be the right answer. So it's sort of getting into the habit of doing those things now and using all that information you have in the best way possible. Okay, next question, or next slide, I'm sorry. Okay, so what we're going to do is we're going to do some practice questions. So there's 20 questions here. Most of them are, I think all of them are multiple choice, except for one is a fill-in. There are no select all that apply in this particular webinar. When we're done with these, or towards the end, I'll explain select all that apply again. But these are common, these are examples of types of questions that people tend to miss a lot, either because they don't read well, or they think it's too easy, or it's something where they could use something else to sort of help them. And so I wanted you to practice with those kinds of questions. If you miss these now, who cares? It's practice. That's what it's for. You know, I hope that everybody gets the majority of them right. But again, if you don't understand something at the end, just write yourself a note, and then at the end we can go back, or you can raise your hand on the chat, and you can ask me a question. Megan and Eric will be good to pass it on to me. Just so you know, these questions are either my original questions or they are modifications of questions that I have written for Linda Silvestri for her Saunders book, for a faculty edition. So they're sort of combinations of all of those kinds of questions. So that's where we're going to start. And the way that we're going to do this is we're going to put them up and we're going to let you answer. And then we're going to look at what answers people picked as a group, not as individuals. So don't not answer because you think I'm going to know who you are. I'm not. And then I'll go over it with you and show you how to answer them, both theoretically and what things would help you if you didn't know the answer. Okay, question 1, next slide. Okay, so oxygen through the nasal cannula at 2 liters a minute is prescribed for a client. The nurse avoids which of the following actions? Okay, so just pick your answer. Okay. So in this particular question, um, all the answers were picked, which is number 2. So that's good. So 2 was not anywhere near the right answer. Okay. The right answer for this question is 4. Okay. Or instructing the client to breathe through their nose only. If you miss this question, you generally miss it because you read it wrong, which is if you miss the word avoids, then you picked either 1 or 3 or A or C because you read the question and you say the nurse should do one of the following actions if you're giving oxygen via nasal cannula. Well, yes, we apply water soluble lubricant to the nares. That's a good thing. And yes, we need to make sure that the oxygen is humidified. But this question said, what do you avoid doing? Okay, so you want to avoid instructing the client to breathe through the nose only. Okay, if they only breathe through their nose and they have a nasal cannula, they're not going to be breathing. Okay, because they can't breathe through their nose only if there's a nasal cannula there. So this is an example of the question and you missing a word in most cases that dictates whether you get the question right or wrong. This is not, if I actually sat with everybody on this call or webinar, and I had a conversation with you about this, you would all know the right answer in verbal. Okay, we would be able to, if I asked you the question verbally, you would probably get it right. But when you read it, if you miss a word, there's going to be an answer there that assumes that some of you are going to miss the word. And the word avoids changes the entire scenario. So for those of you that missed it, most of you didn't miss it because you don't know how to actually prepare oxygen or the nasal cannula for a patient who's getting oxygen. Most of you missed it because you didn't read it well. Okay. So the other thing to remember here is, as far as absolutes in a test item, so only is an absolute, every, always, never, none. Okay, those kinds of words that are so defining that there's no exception to them. If the question is written in the positive, then, and you have 2 options like that, then get rid of the one that has that in there. You don't want, okay, you don't want to use absolutes. Okay, absolutes are bad. Okay, so when you're stuck between 2 answers, if one of them has an absolute in it, get rid of it. And then you're going to get the right answer. So here, you want to avoid instructing the client to breathe through the nose only. Okay, so the word avoids, the word only, and making sure that you read carefully. So fast test takers, if you're a fast test taker, you tend to miss those kinds of questions a lot. So that's the reason that that question is in there. Okay, next question. Okay, so when assessing a client with a diagnosis of bulimia nervosa who has nutrition problems, a nurse would obtain which information first? Okay, so we had every single answer chosen here. Okay, so this is an example of a question that really is more about priority setting or first than it is actually about bulimia. Bulimia is the vehicle for which the question is phrased around. So as a general rule, when things are being asked of a nurse as what you would do first, remember that you need to get basic information first, basic assessment information, whether that's physical assessment or nutritional assessment or whatever it is. So the correct answer is eating patterns and food preferences. That's the correct answer. For those of you that picked A, feelings about self and body weight, or C, feelings about lack of control, feelings is not going to be an appropriate answer for anything that has first in it, or priority in it, or initial in it. Remember, the basic concept that you learned in nursing school is, in order to have effective therapeutic communication with any client, you need to build trust. And feelings take trust in order for them to be exposed to you or discussed with you. So feelings is never going to be, or not usually going to be, a first thing. So while it's important at some point with the patient who has bulimia that you do discuss feelings about self and body weight, and you do discuss feelings about lack of control, it's not the first thing that you do. And that would be the same with previous and current coping skills. You want to try to pick basic general information first. So just like in a physical patient, we say vital signs are first because that's basic general information. When you're dealing with someone with an eating disorder, the basic general information is to get the client to tell you what kind of eating patterns do they have, and what kind of food preferences do they have, and then you build off of that. So again, that's an example of where that first changes how the question is answered. Okay. Okay, next question, 3. Okay, so when caring for a client after an allogenic liver transplant receiving Prograf, you monitor for which adverse med effects. So this question is asking, what's the adverse effect of tacrolimus or Prograf? Okay, so we've got decreased urine output, hypotension, profuse diaphoresis, and photophobia. Okay, so the correct answer for this is A, decreased urine output. And again, I'll explain why. So in general, when you get questions about adverse effects, you want my strategy. So this is a Marshall strategy. My strategy is you choose the worst option that is given to you overall, okay, irrespective of the disorder or the body system. And of those worst things, so in this example, a lot of people would say, well, hypotension is the worst thing, okay? But of that worst scenario, about 85% of those have to do with the renal system, okay? So the theoretical reason behind that is most drugs have some nephrotoxicity associated with them. So in this case, the patient has got a liver transplant, so they obviously, you should know, are taking immunosuppressants, okay? Immunosuppressants are nephrotoxic. So when you have nephrotoxicity, the adverse effect is decreased urine output. Now, if you didn't know that, just by nothing else, you don't have to know anything about the drug, you didn't even have to know about anything about the liver transplant. If you look at an adverse effect and you say, okay, I'm going to pick the worst symptom there, and most of the time, or 85% of the time, it's going to be renal, you could have picked the right answer without even knowing the right answer. And that's the way to become test savvy. So hypotension, yes, it might have been a worse thing in your head there, but really for most transplant patients, hypertension is the adverse effect, not hypo. But again, you can figure this out without having to know it. And one of the things that happens to students or new graduates on the boards is that they freak out about pharm. So That's a strategy that works about 85% of the time. And if it works 85% of the time, you're going to pass the board. So use it when you don't know the answer. Okay, next one. Okay, so this is about radiation. Okay, very good. So for all of you that picked D, that is the correct answer. So uses long-handed forceps to put it in a lead-lined container. Okay, so the key thing here is that when patients have internal radiation, that is radioactive, and anything radioactive needs to go in a lead-lined container. Okay, the red bag, okay, is not correct. Red bags are not used for anything that is radioactive, so we would not pick that. It's good that none of you picked B because that would have been the worst answer. For call the physician stat, as a general rule, don't call the physician unless it's an absolute necessity. There's some type of medical emergency that you see. And for some of you, when you read 4, you might have thought that was a medical emergency. But if you call the physician, the first thing the physician's going to say is, did you pick it up and put it in a lead-lined container? And so if that's what they're going to ask you and that answer is there, then choose that answer. Okay? Okay, next one. Okay, so this is a post-op client who has had pelvic surgery. They have dyspnea and tachypnea. If you suspect a pulmonary embolism, what do you do first? Okay. So those of you that picked C, that is the correct answer. So from a theoretical standpoint, if someone has a pulmonary embolism, you need to get oxygen to them because they may not be oxygenating themselves well. That's the reason that it's theoretically it's C. But if you get confused with all of these answers and you want to know what to do first, remember that when you see the word first, that's priority setting. And so again, you go back to that Maslow mantra that you should have in your head every time you see first, priority, initial, those kinds of words. ABC, other physiological, including pain, safety and security, love and belonging. So the only ABC here is C. You got to give them oxygen. So that's the strategy to use when you're stuck between 2 answers. And one of the things that happens a lot to new grads is that they tell me, I'm stuck between 2 and I don't know how to do it. I can't figure out between the 2 of them. Well, so for those of you that wanted to give heparin versus, and you were trying to debate that with C, if you just go back, because it has the word first in it, if you just go back and do the ABCs, then C would have come to the top, and then giving heparin may have been a little later. And also remember that heparin is not used once you have an emboli. Then you have to use a clot buster, okay, or TPA, or something that ends in ACE, like streptokinase, urokinase, those kinds of drugs that break down clots. Remember, heparin is used to prevent a clot. It's not used once a clot is there. So theoretically, that's the wrong answer anyway. But if you got it down to those 2, that's how you would pick the right answer. Okay, next one. Okay, so on the boards, this would be considered an easier question because it's a basic assessment question. And basic assessment questions are what nurses do. We assess. So knowing how to interpret one's peripheral pulses by a scale is important to be able to do. So the right answer, for those of you that picked full and brisk, that's the right answer. Okay, so pulses, just like a lot of other things, pitting edema, are generally graded or evaluated on a scale of 1 to 4. So if you get stuck or you get an assessment where something is going to be measured on some type of a scale, again, like pitting edema is a common one, or pulses, it's on a scale of 1 to 4. So 2 is normal. Okay, 1 is palpable, or sometimes they'll use the word diminished. 3 is full and brisk, and then 4 plus 4 would be bounding. So for those of you that picked bounding, that's a plus 4. Okay, full and brisk is 3, normal would be plus 2, and palpable would be plus 1. Okay, so do I expect that you're all going to go back and you're going to relearn all your health assessment from the beginning? No, you learn it as you're doing the questions. Okay, you go back and you say, okay, there's this. So for example, if I then say, if I link this to someone who has pitting edema, then you use the same scale. 1 is the least, 2, okay, is the least kind of edema, 4 would be the worst. Okay, so you sort of use it in that same scaling. Okay, next one. And again, as these are up and Megan is switching to the poll, just remember, if you're missing them now, the whole object of missing questions now is to learn from them. It's not to get mad at yourself or berate yourself or, go through a whole mantra of things about why you didn't get it right. It's to learn from it. Okay, so this one's on the CD4 T cell count. And if it's 700 cube millimeters, the result indicates what? Okay. So the correct answer for this one is C. There's an improvement in the client's condition. Now, this is an example, and remember, I put all these questions up for a particular reason. This is an example of when you get a lab result that's sort of out of the norm. It's not like the most common thing that you might get asked about on the boards. But what do you do when you get a question like this? Because you have to answer them. Unfortunately, on a computer adaptive test, you can't go to the next question if you don't answer the one that you're up on. So in this particular question, if you at least know, and you should, because it says the patient is HIV positive, that this is telling us about the immune system. So whether you know what a normal CD4 plus count is or not, and I don't ever care if you know it, I will tell you that a normal is 500 to 1200. That's the normal range for a CD4 T cell count. But even if you didn't know it, you could have answered this question correctly if you just read all the options, which is the key here. When you read everything given to you, including all the options given to you, if you find options or answers that are similar and it's a multiple choice question, they all can't be right. So eliminate them. So if you look at A, B, and D, an infection is likely to develop, the count is dangerously low, and aggressive therapy of IV antibiotics is needed. Those 3 answers are all associated with the patient developing an infection. And so something is wrong. They all can't be right. So just eliminate those 3 and you'd be left with C and you'd pick the right answer. Okay, now, again, on the boards, are you going to be able to do this on the fly? No. The way you get better at this is practicing. And remember, my job, my goal is to make you test savvy. It's not to make you a sound, theoretical practicing, excellent, effective nurse. You should have learned that in school. Okay. Yes, I always tell you the theoretically correct answer and how to get to it. But in this particular question, if you had read all the answers, A, B, and D are too similar. So you get rid of those and you pick C, and you just have to give yourself permission to pick the answer, even if you're not sure, because you know the other ones are too similar and they all can't be right. And then you get the right answer, and you never had to know what the normal CD4 count was. Okay, so that's an example of that, because these are the questions that drive people crazy on the boards, and they would have driven me crazy when I took my boards a long time ago too. And that is, I don't understand it, it doesn't make sense, and I don't know the normal, how am I going to pick it? So that's the strategy you use. What can you eliminate? And then what rises to the top because of that? Okay, next one. Very good. Okay, so almost everybody, with the exception of maybe a couple people, pick the right answer, which is let's discuss your concerns about surgery. Okay, so this is an example of a therapeutic communication question. And on the boards, therapeutic communication questions don't count as psych mental health. They count as therapy communication that we do with all patients. So remember, as a general rule, when you get a question where someone you're having a discussion with someone and you need to give them an appropriate or a therapeutic response, in this case, you want to get them to keep talking to you. You want to get them to keep telling you information. And so if they tell you that they're not sure about surgery, then the best response or the most effective response to get them to continue on is let's discuss what your concerns are about having the surgery, because it makes it a patient-centered response rather than a nurse-centered response. Those of you that picked C, why don't you want to have this surgery? As a general rule, why responses are not therapeutic. So they put the patient on the defensive, and they sort of put them on the spot. So you want to try not to use those. Don't worry, nobody picked it, but don't worry, it is placating them, and it's ultimately your decision. So do basically whatever you think is best, sort of is ignoring the fact that you're just sort of throwing it back on them and you're not pursuing the conversation or the discussion even more. So that's why D is the right answer. Okay, next one. So this next question is a fill-in, and so there's no polling for this. So I basically want you to figure this out, and when you finish it, somebody who is brave, put in the chat or raise your hand and just put what you think the answer is. I don't need more than one or two people doing it, so just if you finish really quick, just put it in there, and then Megan can tell me what somebody said, and then I'll tell you how to do it, and then why it's important to know. Okay, Megan, if somebody puts in an answer, you can tell me what they said.
We have two answers, 27 drops
Okay.
per milliliter or 33 drops per minute.
Okay, thank you. That was Erica.
Yes.
Thank you. Okay, so the correct answer is 33 drops per minute. Okay, now, why is it important? I'll tell you how to do it in a minute if you can't remember from school, but why is it important? First of all, one of the number one things that nurses do in practice is give meds, okay? Whether it's meds or IV fluids or a combination of both. Number two, if you get a math question on your boards, you want to make sure you get it right. Okay, there are two kinds of math questions on the boards generally. One is a IV drip rate, okay, or a med calculation, where you're trying to determine a dosage, and the other is INO. And there are very few of them in the pool of questions. But if you do get one, it's sort of, to me, a giveaway, because every person that graduated from nursing school needs to be able to know how to do this. So you need to do these on the boards. When you go take them, they'll have a drop-down computer, or a drop-down calculator, excuse me, and the proctor will show you how to use it before you go take your test. If you use your drop-down calculator and you are unsure, check the math long-handed. If you are more comfortable doing it long-handed like I am, then just do it long-handed to begin with. You'll have a little whiteboard and you can calculate the math. But people say to me, oh, I got a math question, I must be failing. That's not true. It's just the computer determined that this was a question that met something on the test plan that it wanted to get. So don't worry about it. Okay, so the way that you do these, it's the same for every single IV fluid. Okay, it's volume times drip factor or drop factor. So volume times drop or drip over or divided by time in minutes. Okay, so it's volume times drip over time in minutes. So in this case, it would be 100 times 10 over 30. Okay, and you would get 33 drops per minute. Now, these are the things you need to be careful of with these kinds of questions. First of all, if they're going to give you, if the computer picks a question like this for you, most of the time these questions are not over 60 minutes, because then it's just over an hour and everybody can calculate it. So if you miss the 30, or sometimes it'll say over 15 minutes, sometimes it'll say over 10 minutes, sometimes it'll say over 8 hours, and then you have to calculate 8 hours into minutes, and then you do the problem. Those are big mistakes that people make just because they're not being careful in the reading. And then the other mistake is the actual math calculation of this problem is 33.33. There's no such thing as a 0.3 drop. So you have to round to the whole number. So if it were 33.3, that's how you get 33. If it was a different problem and it was 33.7, then it would be 34 drops a minute. So you want to make sure that you do that. You would be amazed how many times people, again, when you're nervous, you don't always think as clearly. And so people just do the math and they just put it up there and they leave it with a decimal point. And that's wrong, because we can't, it does not work in practice. We cannot do that in practice. So sometimes on the boards, it will say round to the nearest whole number, but sometimes it won't. So you need to be familiar with that. Now, if you miss that problem, then you just want to practice a couple more times with things. You can find them anywhere. If you can't find a practice question with drip rates, you can send me an email and I'll send you some. Okay, next question. Okay, very good. Okay, the correct answer for this is relief of chest pain, but there is a proviso to that, so I'm going to explain this to you. Okay, first of all, nipride, or nitroprusside sodium, is actually an antihypertensive drug. It's a drug that we use primarily for patients who have congestive heart failure, hypertensive crisis. It helps to bring down the blood pressure. That's really the classification of drug. But because in this question, okay, so those of you that picked hypotension, that's why you picked it. But because in this question, it's asking for the intended effect. So what do we want the medication to do? We don't want the patient to become hypotensive. We want to lower their blood pressure to normal or somewhat normal. We don't want to make them hypotensive. We don't want to take the patient from a hypertensive point and bring them down to a hypotensive point. That's why D is wrong, because of the way the question is phrased. What is the intended effect? We would never pick an intended effect of a drug was hypotension. We would pick to lower their blood pressure, but not to make it so that they're hypotensive. So if you know that nipride helps to bring down the blood pressure, it must be relaxing, smooth muscle, or vasodilating. And for that reason, relief of chest pain is the better answer here. Now, I have new grads argue with me all the time and say, well, that's confusing and that's tricky. It may seem that way as you read it now, but in essence, it is not, because it's simply asking, do you know what an intended effect is of a particular medication that, yes, has a primary purpose for hypertensive clients, but can be used for other things as well. And nipride is used for patients who have chest pain for a variety of reasons. So that's why B is the better answer than D. Okay, so it's all about the wording and how it's phrased. Okay, next question. You're all doing good. Excellent. Okay, so here, the patient has a brainstem injury. Okay, so if the patient has a brainstem injury, what kinds of things are we going to be evaluating? So it's respiratory rate and rhythm. This is an application question of you understanding that the medulla, which houses the respiratory center, is in the brainstem. And thus, when someone has a brainstem injury, they are at high risk for respiratory arrest. So that's why you check the respiratory rate and rhythm. So that's good. Most of you got that right. Excellent. Next question. Okay. So in this question, this is actually, people always say to me, oh, well, this is about something beyond what it actually looks like. This is actually a growth and development question. And a lot of the growth and development questions on the boards are written in some version like this, where you need to know the growth and development of a particular age patient, whether it's a child or an older adult. And then what is it that you're going to, or how is it that you're going to respond based on that age? So in this one, it's asking in a 4-year-old, okay, how do you identify adequacy of support for the child's psychosocial needs? So that's the other key, is the psychosocial needs. It's not asking about the physical needs. So those of you that picked C, how much do you know about surgery and its expected outcome? You answered as if this was asking about their physical needs, not their psychosocial needs. That's why that one is wrong. Okay. Same with A. What signs and symptom is your child having? That's a physical response, not a psychosocial response. So if you were able to get rid of A and C and you were left with B and D, then how do you make that decision? So here you need to remember, or you need to have an understanding, that 4-year-olds are still going through separation anxiety. So when their family members leave, that's when they get really upset and inconsolable, and you have difficulty in addressing their psychosocial needs. So the best thing to respond is, or the best thing to find out information about is, will a family member be able to watch the child most of the time, versus what are their favorite toys. Their toys are important, but again, it doesn't address the separation anxiety. It may meet their psychosocial needs, but it's not addressing the 4-year-old who has separation anxiety. And that's why B is better than D. Okay. Next question. We're going to do 1 or 2 more. And then at 12:20, I'm going to stop and I'll answer questions for you. And then I'll tell you how you can get these, and we'll go through some other things.
Lois, this one doesn't have a poll that
Yeah.
goes with it. Okay.
Oh, it doesn't? Oh, I forgot. It's long. I'm sorry. That was dumb of me. I saw the start. Thank you, Megan. Okay, so an emergency room nurse is caring for a client with a suspected MI who is experiencing chest pain unrelieved by nitro. The nurse administers 5 milligrams of morphine, IV. After administration of morphine, the nurse takes which priority action? Okay, so the correct response is D. Okay, so if you pick D, monitor their blood pressure and respiration, that's the right answer. Now, there's a couple things here that you also want to be aware of. One, if you picked A, place the call button at the client's side and instruct them to call if their chest pain's not relieved. That's a good answer. It's just not the best answer. And the reason it's not the best answer is because I put morphine as the drug. So whenever a patient is getting morphine, the priority for morphine is, again, ABC, respirations, because morphine is a respiratory depressant. And if you don't check their respirations and something happens to them, that's malpractice on your part. So you need to make sure that you do it. The reason that I wrote D the way that I did, which is monitor the client's blood pressure and respirations, is because one of the things that happens to new grads, again, either when you're reading fast or you're really nervous, is that you don't read all the way through. And often you're going to see the best information, or the information that makes an answer right or wrong, is at the end of a sentence. So if you didn't get to respirations, you might have picked A. Okay, and B and C are irrelevant to this. Okay, so that's how you answer that one. Okay, we'll do one more. We can do this one. Okay. So those of you that picked A, that is the correct answer. So here's the thing about this particular question. If you got hung up on, oh my God, they have congenital hypothyroidism, I don't know anything about that, no one taught me that in school, then everybody is to blame, your faculty didn't do their job, this happens, that happens, I get all of those things. But hypothyroidism is hypothyroidism. It is. So remember, the thyroid gland controls basal metabolic rate. So if someone's hypothyroid, they're going to have a decreased basal metabolic rate. Of these 4 options, only A is evident of a decreased basal metabolic rate. Hypertonic is increased. Frequent loose stools, increased. Hyperactivity, increased. Those are all signs of hyperthyroidism. And you would see the same thing in an adult as you would in an infant. So it's excessive sleepiness, and that would be the correct answer. Okay, so I'm going to have Megan go all the way to the last slide. Okay, so a couple of things. One, there are like 5 more questions that we didn't cover. So starting from 15 to 20, so maybe 6 questions. So I'm going to have, when Megan or Erica post the file with the PowerPoint and the audio in the repository, I'll just send a little Word document that has the answers to the other 5, so you don't have to wait to get them back from me. And then if you have questions that something doesn't make sense to you, you can ask me. I'll try to put an explanation, as I've done with all of these, next to it, so that you can understand why it was theoretically the right answer, and also the strategy that you could use to answer it. Okay. For select all that apply questions, just to sort of button that up, when you get a select all that apply question, you have to tell yourself that you are not, okay, that you can answer them. You know, you get a brain block that says, oh my God, select all that apply are so hard, I can't answer them because I have to pick every option. And then you start to second guess yourself and you can't figure it out. And so just try to remember that if you think about it in reverse, select all that apply questions are actually easier than multiple choice, because in a multiple choice question, you either have to know why one thing is right, or you have to know why 3 things are wrong. Okay, there's no other way to answer that. In a select all that apply question, you can think broad and out of the box. So you don't want to just think about what the answers might be, but what system is it in? What complications might there be? What risk factors might there be? What other kinds of things can we do to help promote the patient getting better? So you want to think about all of those things. So for example, and I use this example a lot, so if you've heard it before, I apologize. But if you get a question about lupus on the boards, I mean, it's a select all that apply for assessment, and your multiple choice response that you would all be looking for would be a butterfly rash. But on a select all that apply, if it's asking you to pick the assessments that you might note, there might not be a butterfly rash because everybody knows it. So it wouldn't discriminate between who's minimally competent and not. But it might say fever, or it might say pruritus, or it might say dry, scaly skin. And if you only memorized a butterfly rash, you think you can't answer that question. But if you think about, okay, it's an autoimmune disorder. People with autoimmune disorders, our immune response is fever. So pick that. If they have a butterfly rash, they have a rash. What do most rashes do to the skin? They make it dry and scaly. Now you pick that. If someone has dry, scaly skin, what may be the consequence of that? Itchiness. And then you pick pruritus. So it's about looking at things in the broadest perspective rather than in the most narrow perspective. And that's the way to answer them. If you are unsure about answering select all that apply, there are not a lot of them in any of the actual physical board review books. If you use the online stuff for the board review books, or if you use some of the online things that I mentioned, UWorld or National Council of State Boards of Nursing, they'll have more of them. There's also a book that you can, I think you can go like to, well, you can't really go out, but if you live in a place where you can wear a mask and physically distance, and you can go like to a Barnes and Noble, and please don't go to a Barnes and Noble if you can't be safe. Then just find another way to do it, or send me an email and I'll tell you what to do. But if you can, there's a book by La Charity. It's LA and then Charity. And it's a book on delegation priority setting. And it has some select all that apply. And also the Lippincott books. There's an individual book by Lippincott. These are both cheap. That is alternative format questions, and it has some select all that apply. Otherwise, just practice with the things that you have. Okay. So if you have questions, you need help, anything, and I see as I'm watching, people are following me on Instagram now, so that's good. How can you get in touch with me, or how can you find me? Okay, so one is, if you're a Sigma member, you can find me on the Circle. So just go to the Circle. If you don't know how to do it, go on the homepage of Sigma, scroll all the way down to the bottom, find the Circle, click on it. Then when the next page comes up, you'll see the Circle in blue or the hyperlink. Just click on it and then search for Lois Marshall, and you'll find me. And you can email me from there, or you can contact me from there. If you want to email me, you can email me at lsm4556@aol.com. Please just don't make fun of the fact that I have an AOL account, because I really like my AOL account. But you can email me. In the subject line, just put that you are on a webinar, an NCLEX webinar, so I know where I know you from. If you're on Twitter, you can follow me at NCLEX Prof. So NCLEX is capped and then Prof. If you're on Facebook, which I think the majority of people that contact me through Facebook, but just look up Lois Marshall, and then there's a picture of my Yorkshire Terrier. That's how you know it's me. And if you're on Instagram, then again, it's at NCLEX Prof. Now, you only need to do it once. You can contact me any way that you want. Generally, sometime between once to every 6 days of the week, depending on what I'm doing, I post NCLEX strategies, NCLEX words of the day, questions. I normally only post them on Facebook and Twitter, and it's the same one, but I'll start posting on Instagram because a lot of people have been following me there. So I'll post them there as well. So if you need to get in touch with me about anything, that's the way to do it. If I don't respond to you, now that my computer's up and running in like a couple of days, just resend it. Okay, you're not being disrespectful. You're not hurting my feelings. You're not bothering me. My email box just gets full sometimes and I miss things. So just go ahead and resend it to me. Okay, and with that, I will let Erica, I think, is going to do this, open it up to questions. So if you have any questions, if we go a little over 12:30 and you can stay on the call, that's fine. I don't mind. Okay, as long as we have the slot. So you can ask me anything that you want about the test, about studying, about anything.
Lois, we have some resource and strategy questions. For resources, would you recommend Kaplan and ATI resources?
Is that the okay? So
and question banks.
Okay, so here's my philosophy. I have no vetted interest in any product. Okay, I have my own board review, so I have my own stuff. So I don't really have any interest one way or the other. Me personally, so this is my opinion. Me personally, I do not like big box reviews. I don't particularly love Kaplan, HESI, and ATI because they don't, when you practice with them, particularly ATI, you cannot see the question after you've taken a practice test from them. And because I'm a test taking strategy person and I like to break the questions down, they only tell you the content areas that you missed. They don't tell you they won't show you the question that you missed. So for that reason, I don't like it. Kaplan, I don't particularly like because I think that a lot of their review material has incorrect information in it. And the one that I use as an example is if you're priority setting and you're using ABC, other physiological, pain should be first because pain is a physiological assessment. It's the fifth vital sign, no matter where you practice. And in Kaplan, a lot of their material says it's a psychosocial assessment, and it's not. And if you follow that, you miss questions. So for those reasons, and a few others, I don't love them. But if your school bought them for you, or somebody gave them to you, and you have them, anything is better than nothing. So then I say, go ahead and use it. I don't have a problem with it. And if you have a question about something and it doesn't make sense to you, you can email me or you could message me and I'm glad to explain it to you. If you can cut and paste it, that's even better. But I'm always going to tell people if it's already paid for, then it's still better than if you don't study with anything or you study with very few things. So then go ahead and use it. But that's sort of the proviso I give. As far as test banks, I like test banks as long as they're from companies that I have a good understanding of what they're doing. So the reason I like Saunders products and Mosby products, those are both Elsevier, and Lippincott, which is Williams and Wilkins. The reason I like those is because the editors of those three books, Linda Silvestri, Saxton, and Diane Billings, have all been editing those books for over 20 years. They only use people that are experts in test taking or experts on the NCLEX. And so I know that the information and the tests that they're using are going to be a lot like what you're going to see on the boards as far as a test question, irrespective of the content. So if they have test banks, then I highly recommend those. If you want to use UWorld as a test bank, then that's fine. Again, if you have Kaplan, Hesse, or ATI, and you're using them anyway, and they have test banks, those are fine, just knowing the things that I mentioned up front. I think those are all okay.
What tips and tricks do you have related to pharmacology when we haven't heard of the medication, whether it's generic,
Okay.
like whether it's the generic name or the brand name?
Okay, so I have two strategies that I particularly use for farm. And again, if you go back to, if you can look at the July webinar, I think I explained it on there. But as a general rule, when you answer side effect questions for farm, if you don't know, say for example, a question is about Sotalol or beta pace. If they give you the drug so that you can understand the ending, so OLOL or ALOL, then you know that's a beta blocker. And then you want to pick a side effect that's in the same system. Since beta blockers are cardiac drugs, then you pick a cardiac side effect. So bradycardia is the most common side effect of that drug. If you don't know the drug by name, but they give you the health alteration, so they tell you that they're being treated for hypertension, then you do the same thing. You pick the side effect that's in the same body system. So it would still be bradycardia, and you'd get it right. So those two strategies work about 85% of the time. Okay, so people always ask me, well, how do I know that? Because I tested it. I did research on it because it's my strategy. So I needed to make sure that if I tell people to use it, that it's actually works and it's educationally sound, and I'm not going to have people missing questions because of something I taught them. So that works about 85% of the time. If you don't know the drug name, or you can't figure it out, or you don't know the body system or the health alteration, that's the 15% of the time that there's no trick or strategy and you just have to guess. But remember, if you get those kinds of questions right 85% of the time, you're going to pass the boards because 85% is higher than what would be a minimal competency pass rate. So on the 15% that they don't tell you that, just pick, guess and go. And the way that I tell people to sort of help them with that is eliminate things that are really common, nausea and vomiting. That's like for everything. So look for things that are a little out of the ordinary to sort of help you with those. And then it's the same thing with adverse effects that I mentioned in one of the questions earlier. You want to pick the worst thing, no matter what the system is, no matter what the drug is, pick the worst assessment or adverse effect that you'll see, and 85% of the time, it'll be a renal answer. So if you are unsure, then it's good to err on the side of renal things because most drugs tend to be nephrotoxic. So those are the two strategies that I sort of created and that I use, and they're probably the two strategies I get the most feedback from new grads after they take their boards about how they help them. So those are the ones that I like.
In what circumstances would the RN notify the MD?
Okay, so as a general rule, if there is an instance where there is a medical emergency, okay, a medical emergency, like a true medical emergency, a patient is hemorrhaging, a patient has increased intracranial pressure, patient has increased interocular pressure, patient has some word in the health alteration that tells you it's bad, like status epilepticus, status asthmaticus, thyroid storm, Addisonian crisis. Those things indicate to you that they are medical emergencies. Then you can call the doctor. But if one of the other options is something that the physician would ask you about, like their vital signs or checking a lab value or checking for when the last medication was given, if the physician is going to ask you that and one of the options is to collect that data, then do that first. Okay? You don't want to call the doctor and then the assumption is the doctor's going to say to you, well, what was their pulse rate? And that was one of the choices, was to check the vital signs. Then that's the right answer. So that's how you determine when to call the doctor. So it's when there's a medical emergency and you have all the information that they're going to ask you. If you don't have all the information, then look for that as the better option to pick.
Do you know for how long the changes to the NCLEX, including test questions and lower amount time, how long is that going to be for?
We don't know. They update, right now it's through September 30th. And then as it gets into September, they'll update it again. They've been trying to update like on an every 3-month basis. My best guess, and I don't know this, but my best guess is going to be, it's probably going to be till the end of the year, at least, because I'm not sure that the situation relative to what kinds of public health strategies we need to be taking is going to change before then. We're still going to need to be social distancing. And because of that, the Pearson sites can only handle so many students or new grads at one time. So that would be my gut, it'll probably be to the end of the year, but right now it's until September 30th. And usually if I get something from the National Council of State Board of Nursing, even though they post it on social media, if I get it in an email that I get from them, I'll usually go ahead and post it on all my social media sites so that you can all see it, so that if they extend it, that you can see it. But right now, that would probably be my best guesstimate. And, just from that, just remember, you have to take your own mask to the testing site when you go. If you don't have a mask, you can't take the test. So just remember, take a mask, take one that's comfortable for you. And again, they're going to social distance you, which is why there's only a 4 hours. And because there's 4 hours, that's why they lessened the questions.
What is the treatment for pulseless VTAC?
Okay, so that's questions about heart dysrhythmias on the boards do not generally use that terminology. So pulseless VTAC generally does not get asked about in that way on the boards. From a board's perspective, if they want to know about VTAC, they'll ask it straight off that way. So remember that VTAC is going to eventually turn into VFib, and VFib is going to turn into asystole. Anytime that you have a patient that's pulseless and they have no electrical conductivity that's going on, then as a general rule, the question would then be about asystole, because they want to know that you know to do CPR and not to defibrillate them. They generally will not use pulseless tachy as a question on the boards. They like things like normal sinus rhythm, sinus bradycardia, sinus tachycardia, PVCs, VTAC, VFib, and asystole. Those are the most common ones asked about in the pool of questions. Some of you will get one, some of you will get none. Some of you may get more than that. Sometimes they're asked in the narrative where they're asking you what to do. Sometimes they're asked in by them showing you a strip and you having to tell or interpret what the strip is. Remember, only registered nurses interpret EKG strips, not LPNs or anybody else. And also, if you get a strip on the boards that you actually see, it is evident enough that you can figure it out. You don't need to count boxes and you don't need to figure all those things out. Probably the number one mistake that's made about strips on the boards has to do with whether you do CPR or defibrillate them. So remember, you can't defibrillate someone who has no electrical conduction. So that's why asystole is CPR.
What can you do if the water seal on the chest tube is broken?
Okay, so when anything in a chest tube apparatus breaks, obviously you need to assess first. So what's happening? So remember that the water seal, the water seal chamber's purpose is to maintain the pressure gradient between the atmospheric pressure, and the pressure, the intrathoracic pressure, the pressure within the chest. So the water seal is supposed to go up and down with respiration. So sometimes it'll say mimics respiration. Sometimes it'll say rise and fall with inspiration and expiration. If you don't see that, okay, then two things are in play. One is their lung is re-expanded, and the only way to know that is to get a chest x-ray. And the second is that something is broken, as you asked in the question. And if that happens, you generally have to change out the chest tube apparatus, or what you would all call the pleurovac. But that's a company name and they don't put it on the board. So they'll generally say chest tube apparatus. So if you see that, usually you have to call respiratory therapy or the physician, and you have to change out the whole chest tube apparatus. Not the tubing, just the actual pleurovac or the bottles system. If you're using a bottle system, you would have to change that out. These are good questions.
Last question. Can you review top strategy for delegation and priority?
Yeah, okay. So priority setting, I've sort of mentioned already. Honestly, the best way to do priority setting is just ABC. So do they have an airway, a breathing, a circulation problem? Other physiological, which I always say pain is first of those. So pain, and then anything else that's physiological, then safety and security, and then love and belonging, which is all the psychosocial things. So that's one strategy with priority setting. The other is it is actual before risk. So if you were to get a question about one patient, then you would priority set in that way. But if you also got a question about you were prioritizing 4 patients, who do you see first, second, third, and fourth, you do it the same way. Who has an ABC, who has a other physiological, who has a safety and security, who has a love and belonging. And then if 2 people have ABC, so 2 people have problems with their airway, or one has an airway and one has a circulation, if one is actual and one is a risk, then the actual comes first. If someone has an actual breathing issue and someone has pain of like 7 out of 10, the breathing issue still comes first. But if I change it and I say the patient has a risk for ineffective airway clearance, and someone has a pain score of 9 out of 10, then, and that's actual, then that becomes the priority over the risk for the breathing problem. So that's one way to do it. And then also remember that priorities change depending on the information that they're giving you in the question. So for example, if you took a sickle cell crisis patient, we worry about pain with them, we worry about oxygenation with them, and we worry about hydration status with them. So oxygenation is an ABC, and then pain and hydration are other physiological. Depending on the information that the question or the scenario is giving you will change whether ABC is first or whether other physiological is first. So again, sort of that same thing. Is one of them an actual? Is one of them a risk? If someone has an O2 sat of 98 and has even respirations and is not complaining of shortness of breath or dyspnea, and they have a pain scale, again, of say 8, 9, or 10 out of 10, then that is the priority, not the ABC. So it's looking at what the information is to help you. Relative to delegation, the most important thing to remember is that it's a registered nurse exam. So if you're not sure about something, then err on the side of giving it to you, being the RN. That being said, theoretically, nursing assistants should only be delegated, or should generally be delegated, hygienic care, so beds, baths, hygienic care, and feeding, if there's no contraindication, like they're not a stroke patient, they don't have myasthenia gravis, they don't have things that might increase their risk of aspiration, then they wouldn't go to a nursing assistant. If you want to do what you see in practice, which is, oh, well, they do INOs and nursing assistants do this, that, and the other. If you're going to pick one of those, make sure that there's something in there that says, and report it back to the registered nurse. Or the registered nurse says, if you see bloody urine, come and report it to me when you're doing the INO. Then that's sort of how we get around them doing those things that you see in practice. But from a theory standpoint, think basic, they've only gone to school for 9 weeks. The LPN can do meds as long as they're not IV push, as long as they're not in central lines, as long as they're not chemo, as long as it's not blood. Okay. They can do dressings as long as it's not the first one. They cannot do assessment, interpretation, evaluation, verbal orders, telephone orders. They can't do any of those things. They can't do teaching. How do we get around that on the boards? If it's not the first of anything. So they can do dressing changes if the RN does the first one. They can do discharge teaching or pre-op teaching if they're clarifying what the RN has done. So the LPN adds on certain kinds of meds. They can do IV meds, again, but not IV push, not chemo, not central lines, and so forth and so on. The RN has to do everything else. So everything complex, everything critical, everything where there's assessment, where there is evaluation, where there's interpretation, where anything is being done for the first time, and then all those skills that we consider critical skills, again, like chemo, central lines, IV push meds, and things like that. That's how you make the distinction. But just one other point. When you get questions about delegation on the boards, make sure that you read all 4 options, because sometimes what I might have just told you, there may not be any of those things. So say, for example, there was a question and one of the options was to transfer a patient from the emergency room. In general, we don't like nursing assistants, by theory, to go to the emergency room and pick up patients to bring them to the floor, because if something happens to them while they're transporting them, they may not know what to do. But if the other 3 patients are all critical, or there's teaching involved, or there's a fresh post-op or something, that may be the only thing that you can give to the nursing assistant, then you have to pick it. So you have to take the theory part of it and then apply it to the options that they're giving you.
Thank you so much to our presenter today for all this great information. Sigma is grateful that you took the time to share with this audience and look forward to hearing more from you in the future. Be sure to check out Sigma's upcoming webinars, podcasts, and resources to support you and your colleagues. Also, previously recorded webinars and podcasts are freely available on the Sigma repository. Thank you for joining us and have a wonderful day.
Thank you so much.